is now live in the Primary Sense desktop application aimed at frailty care management of your patients. This report identifies patients with frailty indicators that may require review or confirmation of their frailty status. The title of this report is Frailty Care Management. To open this report, click on the Primary Sense desktop application, click on Reports. This screen here will automatically load. Then simply double-click on the Frailty Care Management report. The report will load, then automatically launch in your default browser, just like this. Which patients are included in this report? Patients aged 65 years and over with frailty indicators, including falls, nutrition issues, and feeling depressed, for example, which has been recorded in the past 2 years or marked as active conditions in your practice clinical software. Patients with a frailty indicator from the Johns Hopkins ACG tool are also included in this report. To learn more about the Johns Hopkins ACG tool, please click here, What are the ACG patient complexity levels? Or click the link in the description, which is a short video of me detailing the Johns Hopkins ACG tool. Please note, patients in a residential aged care facility are excluded in this report where possible. The data you are viewing on my screen now is all dummy data. If you scroll down here, you'll see the data. What you can do with any Primary Sense report is click on any of these headers and it will sort for you. So if you wish to sort from youngest to oldest, simply click age once, and it's now sorting youngest to oldest, or click again, oldest to youngest. If you wish to sort by number of chronic conditions, click chronic conditions. As you can see there, starts at zeros, working its way up to an individual, R. Jones, with 11 chronic conditions. Any of these can be selected to sort. We'll work our way from left to right and go through this report. The first column is Remove. By clicking on that, you remove the patient from appearing in this report for the next 12 months. Next up is the ACG score of the patient. This is their complexity score as defined by the Johns Hopkins ACG tool. To learn more about the ACG tool, simply click this box here, which will describe, or view the video in the description below. Next up, we have patient name, patient phone number, when the patient last visited the practice. Existing appointment shows when the patient is booked in to visit the practice again, and the date will be populated here of the date that they are booked in to visit the practice. Next up, we have the GP name. The clinic, this is for 2 practices that share the same server. Next up, we have the age of the patient, the hospital risk of the patient. The hospital risk, once again, is defined by the Johns Hopkins University, and any patient with a score greater than 80% will appear in this report. Chronic conditions. This is the number of chronic conditions coded in the clinical software. Aboriginal and Torres Strait Islander status. Lives alone is coded in the clinical software at the practice and has a yes/no option, as you can see here. Frailty indicator. This is frailty indicators as coded in the clinical software. They are recorded in the past 2 years or still marked as active in the patient's record. As you can see here, some of these frailty indicators are tiredness, depression, weight loss, for example, and falls down here. Next up, we have sedatives history. Yes, no. Next up, chest infection history. This is patients with a recorded chest infection in the past 2 years. Flu history. This is patients with a recorded influenza in the last 15 months. History of flu vax. This is the date of the last influenza vaccination in the past 2 years. But as always, please also check the Australian Immunisation Register. And the last column is the frailty flag. Once again, this is calculated by the ACG, Johns Hopkins University, and is a yes/no option. Please note in this table, N indicates no. Where the cell is blank, like it is here for R. Jones, that means no results were found from the clinical software. With any primary sense reports, you can also export to a CSV by simply clicking this button here. This screen here will appear. It is asking, please indicate your intention as to why you are downloading this report. I am saying I'm showing someone, and I'm providing no feedback. Send response. As you can see here, the report has automatically saved, and I can open it now and view this data in a CSV. As always, any report that you do download in Primary Sense is automatically saved to the workstation that you are currently working on. To view all past reports, simply click on File Explorer, where this screen here will launch. Click on View My Documents. And when Primary Sense was installed by your IT provider, the Primary Sense folder here will automatically appear. Double-click on this folder, and you will see two folders now, Quality Improvement and Reports. Quality Improvement will contain Word documents of quality improvement activities that you have templates that you have downloaded from the Primary Sense desktop application. If you are to go back, Reports. This will show you a history of all the past reports you have ever downloaded in the Primary Sense desktop app from the workstation that you're currently logged in as. These are automatically saved to this folder. To view the report, once again, simply double-click, and it will launch in your default browser. Thank you for watching the Frailty Care Management video today. If you have any questions on the report or using Primary Sense, please reach out to your local primary health network.